Okay, let's talk about polycythemia, another hematological issue. Polycythemia is proliferation of your RBCs. Usually if someone has polycythemia, it's caused, there's a problem going on in your bone marrow. There is another form of polycythemia called secondary polycythemia. It's called secondary because it's being caused by some other thing. Once you fix the cause, it goes away. An example of polycythemia are all mountain climbers who climb very high mountain peaks, Everest and the others. After being at such high levels with no oxygen, they develop polycythemia just to try to compensate for low oxygen levels. Once they get off the mountain, the polycythemia goes away. The primary, or polycythemia vera, is a chromosomal problem, so the issue is down in the bone marrow. Symptoms are going to vary from client to client. Usually the number one sign when a client knows that they have too many red blood cells because they're proliferating is they have headaches, dizzy, so it's that headache that tells them. They can have hypertension from too much. Their hands and feet get red. That's why the word polycythemia vera means reddened, I believe, so polycythemia vera. So these patients, it's a lifetime of basically treatment. The number one way to treat these patients is a phlebotomy. They just go in and take off some red blood cells. They just drain some blood. They're bleeding them like in the olden days, and that takes away the headache, and when it builds back up, they just continue to do that. There's other medication that they can give the patient that'll help reduce the red blood cells. One of them is called Hydrea, Hydrea, also called hydroxyurea, and another one is interferon alpha. These both, though, have side effects. The Hydrea is an anti-cancer medication. So these patients just basically have to monitor their symptoms. They have the phlebotomy. If you take iron, then you're going to make more red blood cells. These patients should not have an iron supplement. They need to stay hydrated as well. When they do a phlebotomy, they just usually take about 500 mLs off at a time. It happens about every 2 to 3 months, depending on the patient. So thrombocytopenia, this is platelets below 150,000. Thrombocytopenia is basically caused by, it can be caused by medications. There's another form of thrombocytopenia called heparin-induced thrombocytopenia. The most common, though, is immune thrombocytopenic purpura. That's just thrombocytopenia without being caused by HIT, heparin. So when someone has low thrombocytes, meaning they can't clot blood, then these people are at a high risk of not forming clots when they need it. They could be at a high risk of bleeding, obviously. So these patients commonly have bleeding. Where would they bleed? Well, most common places are things like, bloody noses that just come on, gingival around the teeth, mucosal bleeding. They may not bleed, but they make petechiae and purpura. That's a common symptom of low thrombocytes. So a petechiae is a small, flat, pinpoint reddish brown dot. They're not very big. So one dot is petechiae, a few dot are petechiae. When they get to be big groups, it's called purpura. So if you have large purplish lesions, then you have more of these, and the more you have, then it looks like bleeding under the skin. So these patients then, if they are in the hospital, they need to be very careful. Let's not stick them a lot because it'll be hard for them to stop bleeding, so watch out for the venipuncture. It may bleed a lot. If they're at home and they have this, then they need to be careful using knives so they don't cut themselves. So these patients, because of the thrombocytopenia, they have to be very careful, watch out for things. Patients, when their thrombocytes go down to below 10,000, we can give them transfusions. We can find out. We can also do bone marrow tests, find out if it's at the bone marrow, if that's the problem. So we can find out what's actually causing it. So when the platelets get really low, the nurse needs to watch for bleeding. So where are you going to monitor bleeding? Where's that going to take place? So treatment and care, what ends up happening because of this thrombocytopenia, if it's being caused by heparin-induced thrombocytopenia, which we'll talk about next week a little bit more, the spleen is going to destroy the thrombocytes. So that's a bad thing that's going to happen. So if a patient has a really bad problem with thrombocytopenia, we can take the spleen out, splenectomy, we can give them corticosteroids, which basically will suppress the spleen doing its job. Do a bone marrow test to rule out leukemia. Anyway, if you don't have the issue with bleeding, so we're going to be watching bleeding everywhere. Don't want these patients to bleed. So if a patient has thrombotic thrombocytic purpura, then we need to find out what's causing it. Sometimes it's an infection. Give them steroids to suppress the immune system. Some of the steroids they would get perhaps is prednisone or methylprednisolone. So a minute, heparin-induced thrombocytopenia. There are some patients, because when they go on IV heparin in the hospital, they really monitor their platelets. If the platelets start to go down slowly or even quickly, they need to stop the heparin. And then they're going to probably put them on Coumadin instead of the heparin. These patients are like having a bee sting the first time it happens. It's maybe a slower reaction. If they ever get IV heparin again, it'll come back even quicker. So we don't want these patients to bleed out because their platelets drop to nothing. So these patients cannot ever have heparin again. So if they've ever had heparin-induced thrombocytopenia, that's never going to happen. Shouldn't ever get it again. Thrombocytopenia Generalities, you want to control bleeding. If they do have low thrombocytes, then they should be using a soft toothbrush. Check for bleeding around the gums. If they've had a venipuncture, they're going to monitor the labs. Which labs are you going to monitor? If someone needs infusion of platelets, then it's called a 6-pack. It's called the 1 unit of platelets, but they call it a 6-pack. So it's basically 30 to 50 ml. It's yellow in color. What other ways should a patient prevent bleeding? They should use electric razors, not straight razors. If they're going to have a venipuncture, have a small needle.